this module, we will explore nursing and the law, focusing on how the scope of nursing practice continues to evolve in today's complex healthcare environment. We will also look at the common categories of nursing staff, explain the process of obtaining nurse licensure, and identify the legal risks that all nurses commonly face. Finally, we will discuss the important role of patient advocacy, examining the various ways in which nurses act as champions for the rights and well-being of those in their care. The scope of nursing practice is evolving, shaped by statutes that define permissible actions, duties, and limits for nurses. This expansion reflects a shortage of primary care physicians, ever-increasing specialization, advances in technology, and growing public demand for accessible high-quality care. Expectations within the profession itself also encourage nurses to adopt broader responsibilities, from performing complex clinical tasks to assuming leadership roles in healthcare teams. By adhering to legal guidelines and professional standards, nurses can safely fulfill these new duties, ultimately bridging gaps in care delivery and playing an increasingly critical role in supporting patient health and well-being. Nurse licensure, state recognition and requirements for licensure. Many states authorize nurses to perform nursing diagnosis within defined scopes of practice. Licensure requirements vary by state, but often include mechanisms like reciprocity, where one state's licensing board recognizes valid licenses from another state, and endorsement, through which boards evaluate whether incoming nurses' credentials match local standards. A waiver process may allow qualified nurses to bypass certain formalities, while an examination remains mandatory in some regions. Overall, these pathways offer flexibility while maintaining rigorous standards, ensuring that nurses meet the necessary qualifications to deliver safe, competent patient care across different jurisdictions. Nurse licensure, suspension, and revocation. Nurses risk losing or having their licenses suspended for a range of violations that compromise professional standards of patient safety. These may include obtaining a license through fraudulent means, engaging in unprofessional, dishonorable, immoral, or illegal conduct, performing activities expressly prohibited by statute, or committing malpractice. Such disciplinary actions aim to protect the public by ensuring that those who practice nursing uphold the ethical and clinical standards required for quality patient care. Practicing without a license. Healthcare organizations are obligated to confirm that every employed nurse has a valid, up-to-date license. Merely hiring an unlicensed practitioner does not necessarily incur extra liability unless a patient experiences harm due to that individual's negligence. If a patient is injured under the care of someone practicing without appropriate credentials, the organization and the unlicensed individual could both face significant legal repercussions. In this slide, we can see the nursing careers types and their importance to healthcare management. Registered nurses often serve as frontline caregivers, coordinating patient care and collaborating with other professionals. Traveling nurses fill short-term staffing gaps in diverse settings, ensuring continuity of care. Licensed practical nurses provide foundational nursing support under the supervision of registered nurses or physicians. Nurse managers oversee clinical teams, budgets, and the implementation of policies, thereby helping to streamline operations. Certified nursing assistants perform essential tasks such as assisting with patient hygiene and monitoring vital signs. Float nurses move between different units as needed, improving staff flexibility. Agency nurses supplement full-time teams on a temporary basis, meeting shifting organizational demands. Special duty nurses concentrate on individual patients, frequently addressing complex medical needs. Finally, student nurses, working under supervision, gain vital clinical experience while bringing fresh perspectives to patient care. In combination, these diverse nursing roles enable healthcare organizations to allocate resources effectively, maintain high-quality services, and adapt swiftly to evolving patient needs. Now let's focus our attention to the nurse practitioner. A nurse practitioner is a registered nurse who has completed additional education and training, enabling engagement in primary healthcare decision-making. This advanced role includes delivering primary care, performing routine examinations, ordering diagnostic tests, and assessing both psychosocial and physical health problems. In many jurisdictions, a nurse practitioner works under the supervision of a physician, and if a nurse practitioner's negligence occurs, that liability may be legally imputed to the supervising physician. Now let's focus on clinical nurse specialist. A clinical nurse specialist is a professional registered nurse with an advanced academic degree, extensive experience, and expertise in a specific clinical area such as obstetrics, pediatrics, or psychiatry. This role involves serving as a resource for managing patients with complex conditions, guiding staff development efforts within that specialty, and helping to set standards of care. Acting as a catalyst for change, the clinical nurse specialist influences team attitudes, modifies behaviors, and implements innovative approaches to nursing practice. By collaborating with other healthcare professionals to develop and carry out therapeutic plans, the clinical nurse specialist ensures that patients with specialized needs receive care of the highest quality. Legal risks of nurses. Patient assessments. Inadequate patient assessments are a frequent source of legal risk for nurses, as they can lead to serious oversights and delayed interventions. Failing to conduct a proper examination or neglecting to take vital signs can prevent the early detection of life-threatening conditions. Likewise, monitoring lapses, such as delaying fetal checks, overlooking the need for a reassessment, or discontinuing an alarm prematurely, place patients at additional risk. A seemingly small oversight, like not repeating vital signs after changes in a patient's condition, can result in a missed opportunity to identify and address a worsening situation. Thorough, consistent assessment practices help protect patient safety and minimize a nurse's liability exposure. Legal risks of nurses. Treatment. Treatment-related errors can significantly jeopardize patient safety and lead to liability for nurses. Delays in treatment, failure to follow a physician's orders, or improper equipment monitoring, such as allowing a Bovie machine to cause burns, are all potentially harmful. Neglecting to recognize that a patient's airway has become dislodged introduces additional risk, given the urgency of maintaining proper ventilation. Even administering care to the wrong patient, often due to an identification failure, can result in serious consequences. Diligence in observing and documenting treatment protocols, as well as verifying patient identity, is essential to minimize these legal and clinical risks. Legal risks of nurses. Infections. Infection control is a critical aspect of patient safety, and nurses who fail to follow established guidelines risk both patient harm and potential liability. Neglecting proper hand-washing techniques, for example, can lead to cross-contamination among patients. Similarly, overlooking or deviating from sterile procedures, particularly in wound care or invasive procedures, significantly increases the likelihood of infections. Ensuring that all protocols for infection control are consistently observed not only protects patients, but also helps nurses avoid legal consequences stemming from preventable healthcare-associated infections. In the context of COVID-19, failing to adhere to proper infection control measures, such as wearing protective equipment or isolating symptomatic patients, can contribute to viral spread and expose nurses and organizations to liability. More traditional negligence issues may arise when inadequate care causes patient harm, such as a laceration during a routine procedure or a more severe outcome like the accidental amputation of an infant's finger. Additionally, failure to follow established protocols or instructions from supervising professionals can exacerbate patient harm and increase legal risks. Legal risks of nurses, communication, and vigilance. Delays in reporting a patient's condition or failing to note clinical changes can significantly hinder timely medical intervention. Nurses who do not verify orders may carry out incorrect treatments, putting patient safety at risk and exposing themselves to liability. Additionally, overlooking or neglecting to escalate a deteriorating condition increases the chances of complications or even fatal outcomes. Effective communication lies at the heart of safe practice. Nurses must promptly share any significant shifts in clinical status, clarify uncertainties, and collaborate closely with other healthcare professionals to ensure each patient's best possible outcome. Legal risks of nurses' discharge. Mistakes during the discharge process can carry serious legal consequences. For example, failing to act when a patient's condition visibly worsens, such as extreme swelling, may indicate neglect and can lead to malpractice claims. Switching infants at discharge, albeit rare, underscores how critical proper identification protocols are in preventing devastating errors. Additionally, delaying the reporting of a patient's deteriorating condition before discharge can compromise safety and continuity of care. Nurses play a crucial role in assessing readiness for discharge, confirming patient identities, and communicating critical information to both care teams and patients to avoid these high-risk pitfalls. High-risk legal risks of nurses. Medication errors. Failing to identify the correct patient before administering a drug significantly increases the risk of giving treatment intended for someone else. Not administering medications as prescribed, giving the wrong medication, or administering an incorrect dosage can all lead to severe patient harm. Properly transcribing and managing narcotics records is also critical, as mistakes in these controlled substances can have serious legal and safety implications. Additionally, if a medication order is unclear, failing to clarify it with the prescribing provider creates further risk. By adhering to meticulous identification protocols, double-checking orders, and promptly resolving uncertainties, nurses can minimize these liability concerns. Chapter review. This concludes our discussion on nursing and the law. As we have seen, State Nurse Practice Acts establish the scope of nursing practice, including the actions, duties, and limits nurses must follow in their given roles. While the core definitions of nursing remain similar, each state has its own Nurse Practice Act outlining nurses' authority and responsibilities. Nurse licensure also varies by state, but all require formal training and examination before granting a license. Methods for licensing out-of-state nurses may include reciprocity, endorsement, waiver, or examination. In summary, nursing offers a wide range of career paths, from registered and traveling nurses to more specialized roles such as licensed practical nurse, nurse manager, certified nursing assistant, float nurse, agency nurse, special duty nurse, and nursing student. Advanced practice nurses, such as nurse practitioners, clinical nurse specialists, and certified nurse anesthetists, assume an expanded scope of responsibilities through additional training and certification. Regardless of the specific role, nurses face common legal risks that include maintaining two standards of care, ensuring accurate patient identification, monitoring patients diligently, reporting changes in a patient's condition promptly, administering treatment without delay, following all orders, documenting care accurately, practicing correct medication administration, complying with infection control protocols, and preventing negligent procedures or falls. Thank you for watching and listening to this videocast. We hope this overview of nursing careers and legal considerations will guide you toward a safer, more effective healthcare management practice.